Hello, in today's topic we will talk about a very interesting topic, that is insomnia. Topic which we will covered while discussing about this insomniac problem. So they are, first of all, we will discuss about the sleep cycle, that what are the NREM sleep cycle, what are the various stages of sleep cycle, and what is REM sleep cycle. After that we will discuss about basically about the insomnia and what are the various types and what happens if a person doesn't get enough sleep. And after that we will talk about why one should stop taking sleeping pills for insomnia and what are the side effects of taking sleeping pills for insomniac person. We'll talk about that. And lastly, we will talk about the top 7 homeopathic remedies for insomnia. And lastly, we will talk about the management, that what is the ultimate management for insomnia. So let's start our today's topic, that is insomnia. So before starting insomnia, first of all, I would like to discuss about sleep, its cycle, and what are its various stages. So, what is sleep according to you? So according to me, what is sleep? An altered state in which person become relatively unaware of the external stimulations. This is the basic meaning of sleep. Now we will discuss about what are the various stages of NREM sleep cycle. Now what does NREM stands here? So it means non-rapid eye movement. So as you can see here on the screen, we have provided a picture of the 5 stages of sleep cycle. Stage NREM stage 1, NREM stage 2, NREM stage 3, NREM stage 4, and lastly REM stage. Here REM stands for rapid eye movement. So now we will talk about these various stages and what happens during these stages. So we will talk about that. So first, as you can see here on the screen in this picture, that is sleep cycle. So the first stage, stage 1. So that is interim between consciousness and sleep. Now what happens in this stage while you are in sleeping phase? So in this phase there will be light sleep, muscle activity slows down, there will be occasional muscle twitching. This was all about the stage 1, that is NREM stage 1. Now what happened after 5 to 15 minutes that results in the formation of second stage of NREM. So in second stage, breathing pattern slows down, heart rate slows down, there will be decrease in the body temperature. So this is the stage when brain does less complicated tasks. This was all about the stage 2. Now after another 15 minutes, stage 3 will occur. So what happened in NREM stage 3? So body make repairs, deep sleep begins, there will be slow delta waves generated. This was all about the third stage. Now after third stage, fourth NREM stage will be formed. So what happened during this stage? Body temperature increases, blood pressure decreases, and there will be very deep sleep, there will be rhythmic breathing, limited muscle activities, and delta waves will be produced. And approximately 90 minutes after first feeling sleepy, that is the introduction of the fifth stage of the sleep cycle, that is REM stage, rapid eye movement. Now what happened in the fifth stage of the sleep cycle? So in this phase, there is increases in eye movement, blood pressure and temperature. Brain waves speed up, dreaming occurs, muscle relax, heart rate increases, rapid and shallow breathing will be there. So this was all about the 5 stages of sleep cycle. And next we have brain wave cycles. So during sleep cycle, various waves are responsible. So here we have provided a picture. You can see here very clearly we have 4 waves, that is beta, alpha, theta and delta. So these are the 4 waves which are responsible for the sleep cycle and which help in dream. So this was all about the sleep. Now why we are talking about, think for an instance, what happens when your body is unable to work according to the sleep cycle which we have discussed few moments earlier in this video. So when your body will not be able to cope with the sleep cycle, so it will lead to some kind of sleep disorders in your body, and that is called insomnia. So which is our basic today's topic, that is insomnia. Now I think it's clear to you that what insomnia means. Whenever your body is unable to work according to the sleep cycle, it leads to sleep disorder that is called insomnia. Now we will discuss about insomnia. So what exactly one can define insomnia? Insomnia basically means a person who is unable to sleep. So according to me, insomnia, which is also called as sleeplessness, it is a common sleep disorder in which a person experiences difficulty falling asleep, difficulty staying asleep, or wake up too early. This insomnia can lead to long period of wakefulness and difficulty initiating sleep. It can also cause a person to wake up early and not be able to fall back asleep or maintain sleep. So according to me, this is the exact meaning of insomnia. You can also see a definition I have provided here according to Wikipedia, that what is insomnia. So every person tends to experience sleeplessness occasionally and usually. It gets resolved on its own with a good night's sleep. Diagnosis of insomnia is made when a person faces difficulty sleeping for 3 nights in a span of a week for minimum of 3 months, and it is causing significant distress in everybody's life. Now next, we will discuss about what are the various types of insomnia, that how you can diagnose that you have this type of particular problem, you are suffering from this particular type of insomnia. So one by one we will discuss about them. So as you can see here, we have 5 types of insomnia. First, acute. Second, chronic insomnia. Third, comorbid insomnia. Next, onset insomnia. Next, maintenance insomnia. Now one by one we will discuss about them, that what exactly they means. So first type, that is acute insomnia. What does it mean? A brief episode of difficulty sleeping. Acute insomnia is usually caused by a life event such as stressful change in person's job, receiving bad news, or travel. Often acute insomnia resolve without any treatment. So as you can see here, acute insomnia is not a big problem. We can eradicate it from our life easily. This was all about acute insomnia. Now second, chronic, means which have a very deep impact on our life. So the chronic simply signifies here, now we will discuss about that is what is chronic insomnia. So a long-term pattern of difficulty in sleeping. Insomnia is usually considered chronic if a person has trouble falling asleep or staying asleep at least 3 nights per week for 3 months or longer. This was the definition of chronic insomnia. Now, some people with chronic insomnia have a long-standing history of difficulty in sleeping, and it has many causes behind this, and later on we will talk about them. So this is chronic insomnia. Now next type, that is the third type of insomnia, we have comorbid insomnia. Now what does it mean? Insomnia that occurs with another conditions like psychiatric problems, psychiatric symptoms such as anxiety and depression. Again, I'm repeating here, it's mainly due to anxiety and depression, and these are known to be associated with changes in the sleep. So certain medical conditions can either cause insomnia or make a person uncomfortable at night. As in the case of, let's take an example of an arthritic patient, or you can take example of back pain, which may make it hard to sleep. So these are the example of comorbid insomnia. This was all about the third type, that is comorbid insomnia. Now next, that is onset insomnia. What does it mean? It means difficulty falling asleep at the beginning of the night. That is, in the first half of the night, person is unable to sleep. Next, which is the last type of insomnia, that is maintenance insomnia. The inability to stay asleep. People with maintenance insomnia become which the person is unable to sleep in the second half of the sleep. That is the later half of the sleep. So this is the fifth type of to all. And by understanding these terms, you will be aware that what type of insomnia you have, or your surrounding people have, or your friends have. Through these 5 types, you can differentiate between them. This was all about the type of insomnia. Now next, what happens if a person doesn't get enough sleep? Now we'll talk about it. This is a very important topic to discuss here. So, not getting enough sleep can lead to the following effects on the human body. First, waking up unrefreshed, tired in the morning. Second, feeling sleepy in the daytime. Third, feeling weak, tired, fatigue during daytime. Fourth, remaining irritable during the day. Fifth, having low mood, that is mood swings. Next, depressed feelings. Next, again mood swings we are talking about here. And next, having difficulty concentrating during daytime. Next, reduced alertness. Next, poor performance at any task. Next, higher risk of the accidents. And next, chronic insomnia may lead to weight gain. It does so by affecting the way our body processes and store carbohydrates. Chronic insomnia is a risk factor to develop type 2 diabetes mellitus, hypertension, and heart diseases and stroke, and also angina pectoralis. So these are the signs and symptoms, or you can say the clinical features of insomnia. That what happens if a person doesn't get enough sleep. Now next, we'll talk about sleeping pills. Why one should avoid taking sleeping pills for treatment of insomnia. What's the need to avoid them? Why we are talking about here? About the sleeping pills. So, let's discuss about this. Conventional treatment for insomnia employs the use of sleeping pills or the sedative hypnotics to induce or maintain sleep. The different types of sleeping pills include specific hypnotics, benzodiazepines, and barbiturates. Common benzodiazepines like Valium, Librium, Ativan, they increases drowsiness, thereby enables sleep in the human body. Most of these drugs are potentially addictive and are known to cause memory and attention problems. In most cases, they are not recommended for long-term treatment of sleeping problems. Some new drugs are now replacing benzodiazepines, which are not habit-forming but still can cause physical dependencies. Some common side effects of taking sleeping pills, we will talk about them. So they are change in appetite, diarrhea, constipation, headache, gas, or you can say flatulence, drowsiness during daytime, dry mouth and throat, tingling sensation in the limbs, difficulty maintaining balance, heartburn, memory and attention problems, weakness, stomach-related issues will be there. And another serious potential side effect of sleeping pills is parasomnia. Now, what is parasomnia means? So, parasomnias are involuntary behaviors and movements like sleepwalk. Have you ever wondered a person walking in the sleep? So, they produce this type of parasomnias in the person, over which an individual has no control. Person will walk in sleep. So these are the basic side effects of taking sleeping pills. During an attack of parasomnia, the person is asleep and unaware that they are walking in sleep. Sleeping pills are usually prescribed on a short-term basis since they tend to stop working once the body builds a tolerance to the drug with time. So this was all about sleeping pills and parasomnia, why one should avoid taking sleeping pills for treatment of insomnia, and what are the various side effects and why they are harmful for your body. And yes, these sleeping pills enables your body to reach in the 5th stage of NREM sleep cycle, that is called REM stage. So next we will talk about now how you can deal with this problem. What is the treatment now? If you will not take sleeping pills, then what you will take? Then what you will do for the management of insomnia? So here I would like to discuss about top 7 homeopathic remedies for insomnia with 0 side effects. They have 100% natural 0 side effect on human body. You can absolutely and what definitely can take for curing your problem, and within 3 or 5 months you can get rid of this problem that is called sleeplessness. So now we will talk about those 7 top homeopathic remedies for insomnia. So one by one we will discuss about them. So first medicine, as you can see here on the screen, we have provided a picture, that is PHOS. So this is the first best indicated remedy for insomnia due to stress and any kind of worry. Now what are the key indications for using PHOS for insomnia? So symptoms here are insomnia from stress and worries. Second, sleeplessness during the later part of the night. Third, night terror in children causing disturbed sleep. And PHOS is a very useful medicine for insomnia, as we have discussed about the key indications, that is insomnia from stress and worries, sleeplessness, mainly during the later part of the night, that is the second half of the night, excessive yawning, a sad feeling, gloomy disposition, extremely fatigue both on mental and physical level, and sudden waking from sleep in children due to night terrors are the common symptoms that indicate the need for a dose of PHOS medicine for insomnia. So if you have such type of symptoms in your body, you have such type of difficulties while insomnia, you can definitely take this medicine, that is PHOS 6x potency. Now next medicine which we have, as you can see here on the screen, we have again provided a picture, that is Coffea cruda. So it is indicated for those insomniac persons who is constantly suffering from the thoughts again and again coming inside their mind while sleeping. So what are the key indications for using Coffea cruda? First, insomnia from constant thoughts in the mind. Second, early waking from sleep with difficulty to fall asleep again, that is second half of the sleep. Third, disturbed sleep from excessive dreams. So Coffea cruda is a beneficial medicine for insomnia. It arises from constant thoughts in mind. During bedtime, many ideas crowd in the mind. The person remains restless at night and experiences sleeplessness, tossing from side to side. Palpitations and nervousness may attend it. This medicine is also helpful in children who are playful at night and are sleepless. Coffea cruda is also well indicative for early waking from sleep, usually second half of the cycle of the sleep, that is at 3 a.m., with difficulty in falling asleep again. Insomnia during the phase of recovery from some illness is also treated with coffea cruda. This remedy also offers help in the cases of disturbed sleep from excessive dreams. This was all about our second medicine. We have discussed about the various symptoms on the basis of which you can take this medicine, that is coffea cruda. Now our third medicine for insomnia, that is Ignitia amara. So it is for insomnia from grief and depression. So now we will discuss about the key indications for using Ignitia amara for insomnia. It is a medicine for insomnia arises from grief and depression. The person needing Ignitia amara is depressed and full of tears, care, and worries. He or she may get entirely absorbed in profound grief that leads to sleeplessness. Other attending features are a desire to be alone, tearfulness, and sadness with deep sighs. The person keeps thinking about the sad occurrences in the past. Excessive brooding, moaning, and an indifferent behavior to everything may also be present. So these are the key symptoms on the basis of which you can prescribe this medicine to your patient for treating insomnia for permanently. That is Ignitia amara. Now our next medicine we have on the screen, that is Nux vomica. For insomnia during later half of night. Now what are the key indications on the basis of which you can prescribe this medicine to your patient who is suffering from insomnia during later half of the night? So Nux vomica is a valuable medicine for insomnia when sleeplessness occurs during the second half of the night. A person requiring Nux vomica has no trouble falling asleep, but he suddenly wakes up around at 3 a.m. and 4 a.m., after which sleep becomes difficult for them. They are unable to sleep. And during daytime, intense drowsiness, tiredness, and weakness appear. Nux vomica also works in cases where the sleep is not sound and the person often wakes from sleep. It also treats sleeplessness linked with an excessive intake of coffee or alcoholic stimulants or tobacco. Sleeplessness due to gastric troubles is also an indication for using homeopathic medicine, that is called Nux vomica. So on the basis of these symptoms, you can prescribe Nux vomica to your patient for insomnia during later half of the night. This was all about Nux vomica, which is our fourth medicine. Now, our fifth medicine, that is Passiflora incarnata, homeopathic medicine for insomnia in elderly people. So, now we will discuss about the key symptoms on the basis of which you can prescribe this medicine to your patient. So, Passiflora incarnata is a prominently indicated medicine for treating insomnia in older persons. This medicine is prepared from a plant named passion flower, belonging to natural order Passifloraceae. The person needing Passiflora incarnata remains wakeful and restless at night. Mental worries may also be present with insomnia. This medicine is also indicated for insomnia in infants. So these are the various symptoms on the basis of which you can prescribe this medicine to your patient who is suffering from insomnia, that is Passiflora incarnata. Now our sixth medicine for insomnia, that is Chamomilla vulgaris, for disturbed sleep from frightful dreams. What are the key indications now? So Chamomilla vulgaris is a natural medicine prepared from the plant German chamomile. It belongs to plant family Compositae. It is an important medicine for disturbed sleep resulting from frightful dreams. The person wakes suddenly with a start and be pink or fearful. These episodes occur several times at night, resulting in disturbed sleep. The person is sleepless till about 2 a.m. Sleeplessness from illusions of sight and hearing is another indication. For using homeopathic medicine chamomilla, the person may be highly irritable and sleepy during the day. So these are the symptoms on the basis of which you can prescribe this medicine to your patient, that is Chamomilla vulgaris for insomnia. Now we'll talk about our last medicine, that is the seventh medicine for insomnia, that is Robinia. For insomnia due to GERD, means gastric reflux problems. So what are the key indications now? So this particular medicine is prepared from the plant which is known as yellow locust. The natural order of this plant is Leguminosae. A person needing Robinia suffers from GERD and experiences worsening of the symptoms at night, which disturbs the sleep. Symptoms like heartburn, sore belching become worse at night, disturbing the sleep. So homeopathic medicine Robinia treats GERD and its acid reflux symptoms, and this usually resolves the problems of disturbed sleep. So this was all about the top 7 homeopathic medicines which you can prescribe for insomniac patients. Now along with these medicines, you can try best management for insomnia, that is you can try meditation at least for half an hour at home, at least twice a day, and you can perform exercises, yogas, pranayams, and along with these medicines, if you will perform meditation, exercises and pranayams and yogas, they will definitely give you a permanent cure. So this was the best management for insomnia, that is yoga, pranayams, exercise and meditation. So this was all about insomnia. We have discussed about sleep cycle, why sleep is necessary for us, and if our sleep is disturbed, we are unable to sleep, then it leads to a very hazardous problem, that is a sleep disorder called insomnia. What are the various signs and symptoms, and what happens if you don't take appropriate sleep? What are the signs and symptoms which are produced inside your body due to insomnia? And what are the best top 7 homeopathic medicines which you can take for permanent treatment of insomnia? And along with this, we have discussed about management, that is yoga, pranayam, meditation, exercises. So this was all about for today. See you guys in our next video. Till then, stay connected with us and don't forget to subscribe our channel and comment below. And thanks for watching our video.